My research is largely centred on the design of cardiovascular devices, in particular replacement heart valves. We have in the developed world a growing group of patients who are benefiting from replacement heart valves. In the global south, there's an even bigger population, particularly young people, who need to benefit from replacement heart valves, and so that's a real focus of our research, to come up with devices which can be used particularly in the more developing parts of the globe. I've worked with clinicians for many years and a wider research team, but it's only more recently that I've recognised the value of engaging with public policy. By way of example, N.I.C.E in my particular field, the National Institute for Clinical and Health Excellence, we've had some conversations with them, and what became very clear was that they are keen to be involved from an early stage. So my recognition in the latter part of my career that to be working with these bodies from an early stage is really important, to be engaging with the public and patients in a similar way, as well as working with the clinicians to understand how our engineering ideas can really make a difference to real people in the clinic. Interestingly, whilst I've been very focused on the engineering side of my research, I had started having some conversations with people in the public policy team at Southampton and woke up to the potential for engaging even more deeply. And that led to them getting involved in the current project, and they're providing, not only are they providing contacts to the regulatory bodies, to people in N.I.C.E, they undertook a stakeholder analysis very early in the project, which is proving extremely useful for identifying where we should go later in the project. And part of that activity links very nicely to the fact that we've also got people who understand the humanitarian issues, some of the business issues, that will provide the link between what we're doing in providing a device, what public policy can identify by way of the context and the people we should be speaking to, and then the business people we're also working with can then take that to then engage directly through NGOs, understanding, as I said, the humanitarian element to all of this, such that everyone wins. Most importantly, the young people across the globe who currently suffer from heart disease, who don't have access to replacement heart valves. To give the best advice I can, I'd say get involved now, whilst you're at the earlier stage of your careers, because the opportunity is huge. I'm only realising it now, quite latterly in my career, but the benefits are evident from the beginning of this research project. The contacts are being provided, developing my understanding of what could be possible from my research.